Good afternoon, ladies and gentlemen. Welcome to this new segment of Medcast. Today, we are pleased to have Mr. Yousef AlSaleh, who specialized in physical therapy. Mr. Yousef, also a holder of a Master of Science in Chiropractice. Welcome, Dr. Yousef, again.
Thank you for having me again, and it's always good to be back.
We are so pleased to have you again
Thank you
because
so
in the
much.
last episode, you have mentioned very quickly chiropractic,
Yes,
and people still don't know in Kuwait what is chiropractic exactly. So, can you explain more in details what
yes,
is
of course.
chiropractic?
So I'm sure you've seen the TikTok videos. It's gone very viral recently.
Yes.
There's a lot of cracking involved. Those really ASMR sounds of cracking the neck and cracking the spine. At the end of the day, chiropractic is spinal manipulation or spinal adjustments that directly support spinal
Hmm.
alignment. Chiropractors believe that the whole root cause of any problem comes from the spine, and I also support that belief. So chiropractors tend to look at all the vertebrae in the spine, manipulate them to going back into place,
Hmm.
relieving the pressure that's around the vertebrae themselves. And the pop sound that we hear, or the cracking sound, or like this small little,
Yes. Which I which
it's
I'm used to do it every
everybody.
time.
And I'm sure you've heard the rumor from our parents that if you keep doing it, you
You will
get
get
rheumatism
arthritis,
or
yes,
you
or
get
rheumatism,
arthritis.
yeah.
There still has not been one single case related of you popping your fingers or your neck and that you would
Well,
get arthritis.
the ongoing question always is, what is the reason of that sound?
So
Why we are hearing
basically,
that
all the
sound?
joints have synovial fluid in them.
Yeah.
This is what lubricates the joint. This is what gives the joints support or
Mm.
movement. So that synovial fluid is moving through your joints, and as it's moving, it's creating a little bit of an air bubble.
Mhm.
So that's it. It's just the air pressure moving out
So
of
you get
your.
used to it doing it
I got
every time.
used to it, and it's very relieving. If you even think about it yourself, sometimes you have a kink in your neck, and all you want to do is just tuck and
Yeah.
you
You
get
feel
relieved.
comfy again.
So what we have to also make sure is that there's barriers for us as physical therapists and as chiropractors. So not everybody I would give that cracking or spinal technique.
Hmm.
There are patients where I've actually refused some patients from giving them a neck crack. For example, patients who are 65 years old and above, we tend to give them other forms of therapy just
Yeah.
because of the wear and tear and usually the aging of their vertebrae. So
Hmm.
we have to respect that. Other cases like patients who have active tumor cells, patients who have a pacemaker, patients who are on cortisone medication, these are kind of patients we don't really crack.
No, the question is, let's make it clear to the audience. Is every physiotherapist is a chiropractor or not?
No. So I was a physical, oh, I still am a physical
You're still
therapist.
you're
I
still a
still
physical
am a
therapist, yeah.
physical therapist. But when I was a physical therapist, I had my physical therapy degree.
Hmm.
And then I got the chiropractic degree based on my physical therapies.
Hmm.
So I took it one step further. So the way that I work is holistically. So
Hmm.
you work as you take the school of physical therapy and the school of chiropractic and combine
You
them
mix them
together
together.
to give the best results. So what a physical therapist would reach in three results, I would in three sessions, I would actually reach in one session,
Hmm.
just because you're really giving the muscle both benefits. But physical therapy is one thing and chiropractic is another thing, but we're all under the same umbrella. We're all under the same family.
So that's why some people mix up between the two
It's not the
specialties.
same.
Now,
Because, yes, go
yeah,
ahead.
another question is like when you spoke about the chiropractic, you were focusing mostly on the spine. Does that
Exactly.
mean that the chiropractic is only focusing on the spine?
It focuses on all the joints of your body,
So anywhere in the body.
all the joints in
So
your
let's
body.
say every Kuwaiti house is having a mini chiropractic, as we always crack our no,
Everybody,
our
everybody.
okay,
Our fingers and our joints and our neck and lower
anywhere,
back.
yeah,
And there's the ongoing, oh, I was in the Duani and my friend stepped on my back. And please
yes,
don't do that. Please,
yes,
please, please don't do that.
uh,
Or the
yeah.
barber shop story.
They used
Wherever
to
you
make
go
the
to the
crackling
barber
of the
shop,
bones
if you're going to a
of the
barber
neck.
shop, please just cut your hair. Don't do anything with your neck. So the question was, is it
Is it only
only for the
focusing
spine?
on the spine? Yeah.
No, no, yes and no, because the majority of the chiropractic does focus on the spine.
Hmm.
But we have our shoulder joint, our elbow joints, our hip joints. These are also focused on with
As you
chiropractic.
mentioned, the Duania practice, let's say, do you recommend that practice that the people, everyone is doing that either by asking like a small child because they say he doesn't have a very heavy weight to step on
To
my
step on
back,
my back,
or any friend to step on with only one leg?
I would say avoid it, but it's impossible.
Yeah, I
At
know.
this point, it's impossible because I've been guilty of doing it. I've had my baby nephew walk on my back, but I would say be careful, first of all, and always, if it's a serious condition, always go to a person who's specialized, as to a physical therapist, to a manual therapist. Always go to somebody who's specialized. Don't procrastinate to do it to the Duania for somebody who's just experienced.
Yeah. Well, that takes us for another question, which is similar somehow to the physiotherapy
Mhm.
practice. Does the chiropractor as well might prescribe some medication for the patient if he's having pain or something?
No. So the main difference between us and medical doctors as physical therapists, especially here in Kuwait, we only have a physical therapy license as a bachelor's degree.
Mm.
So the government still doesn't allow us to actually have a DPT, which is a doctor of physical therapy,
Yeah.
which we're grateful for to have the bachelor's degree.
Mm.
The main difference between me and a medical doctor is that I cannot prescribe medication and I cannot diagnose a patient.
And you
Even
cannot even like advise patient to take some medication, even if they are OTC.
as a supplement that you can buy over the counter, yes, you
Yeah.
can. But a medication from a pharmacist, no, it's illegal. I cannot prescribe a medication and stamp on it, even if I have a PhD.
Hmm.
It has to be a medical doctor that prescribes medication.
Yes.
You can actually advise, and they could ask a doctor and you can buy it. Yeah, but as a physical therapist, I can't.
Okay, that's great. Now, as you are an expert in that field,
Mm.
I think you have seen so many patients coming from Kuwait with having a mutual problem. So, what is the most common problems you have seen as a chiropractor?
You'd be very surprised, and that's actually one of the best questions you can ask me. And not a lot of people ask this question. Um, I used to think it was low back pain. I used to think it was low back pain.
What do you think is the reason of the
It's a sedentary lifestyle,
sedentary
just
lifestyle?
sitting and not doing anything, driving a lot.
Yeah,
But now, for the past 5, 6 years, it's actually changed. It's not low back pain. It's more neck pain.
neck pain
Why?
because of the phone.
Exactly.
That's very clear. And is there
Everybody's like,
any way to deal with that problems?
well, limiting screen time is one of them. Because not just we're not just dependent on the phone.
Hmm.
In our society, in our country, we're also dependent on the air conditioning.
Yeah.
And that artificial air is not as good for you as much as the natural air.
Does that have an
So
effect on the body as
it
well?
does,
Yeah.
100%. So especially when we're sleeping. So this is another question I had when I got my master's of chiropractic in Sweden.
Hmm.
And so we were changing experiences, and I said, one of the most common injuries that I'm having now is neck related injuries going down to the rhomboids,
Hmm.
going down to the mid spine. And they said, we don't have that problem here because you guys have artificial air. We
Yeah.
don't, so they have more low back pain injuries. We're I would say because of the lifestyle and the sedentary lifestyle, it's usually neck pain and low back pain injuries.
Okay, that's right. Now the question takes me to
How
the
do I avoid it?
yeah, have to avoid
How
that.
to avoid it? Well, exercising and living a healthy lifestyle, it's one of the best things that you can do as a gift to your body,
Mm,
because our bodies are meant to keep moving. We are made to move. We are
mm.
not made to sit down. And this is what I'm going to say now is a very good fact or important point for the viewers or for the listeners, is that if somebody walks 10,000 steps a day, they will not be suffering from any spine or low back pain.
That's great.
This is based on
And very easy
evidence.
as well.
It's not that easy.
Well, at
It's
least
not that
it is
easy,
somehow
but
easy.
it's doable.
Yeah.
It is doable. It's not impossible. That's what we're trying to say. Actually, 10,000 steps a day is almost an hour to an hour and 20 minutes of constant walking.
Hmm.
So if you take that hour and you spread it throughout the day, this is when it's going to be easy. This is for sure it's
You,
going
you
to
can
be
you
easy.
can you can make life easier if you want to.
Yes.
So you
Yes.
give us a solution as well by
10,000
dividing
steps a
the
day.
steps. Yeah.
And we also we have to be very thankful for living in a country where it's easily accessible to go to a gym. It's easily
Yes.
accessible to have somebody, because I'm not the only expert here. There's thousands of experts in Kuwait,
Yes.
so it's easily accessible to go to an expert. It's easily accessible to go to healthy food.
Some
To
say, if you remember, one of the most famous persons in the social media have said that in Kuwait we have gyms more than restaurants.
Yes,
Yes.
yes, we have a lot of gyms, and not just gyms. We have some of the best gyms in the world.
Yes.
So let's take the opportunity.
Well, I do have two more questions, which will be the last two questions of this episode.
Okay.
When we spoke about the chiropractic, you spoke about the bone crackling, which
Yes.
most commonly the society believes that if the patient or someone is having that crackling means he's in an old age enough.
Mhm.
Is that right or not?
Yes and no.
Sometimes when we stand up and we hear the crackling, we say, "Oh, I've
Yeah,
been
yes and
old now."
I'm getting older now. Well, in a sense, doctor, yes and no. So most of the time it's because you're active, it's
Yeah.
because you're moving, and it's because your joints and your tendons are moving. That's why you hear the clicking sound. But as we age, as we get gray hairs, your vertebrae also age and your joints
Yeah.
also age. So this is also a sign of aging, but let's not be scared. The thing that I want to say is that if you get those cracks with pain, then you
That's
should
the
go
point.
to a therapist or a chiropractor.
Yeah.
If you're praying and if you're walking and if you're just walking and
Like if
there's
you're
cracks,
doing them normally
no pain
anytime,
and
like
no
now.
nothing, it's fine.
Okay,
It's fine.
that takes me to another question, which is away from your practice.
Mhm.
What made you going to Sweden to have a degree?
Well,
We normally hear about the
they
UK, we
were
normally hear
yeah,
about the Czech Republic,
yeah.
we normally hear about Canada and the US, but Sweden, this is the
Sweden,
first time.
because the college that I went to was the Ackerman College, and
Hmm.
the Ackerman College is one of the best known chiropractic approach. They call it the Ackerman approach or the Ackerman way of treating. And when I contacted them, they easily accepted me because I was a physical therapist.
Yeah.
So they didn't want me to do the whole cycle again. So it was one of the few colleges that when I contacted, they said, yeah, as long as you have a physical therapy degree and you're practicing in your practice, you can continue with us. Actually, yeah, that was one of
How
the
long did
reasons.
it take from you?
Not that long. You would be surprised because the theory part,
Yeah.
as a physical therapist, I have more theory than a chiropractor.
Yeah.
And it was very nice because when I went to do my basic chiropractic course, not the master's, the basic one, everybody there was from different backgrounds. So you would have chiropractors, but you would also have surgeons,
Yeah.
and you would also have physical therapists, and you'd also have a manual therapist. And so when I asked the surgeon, I'm like, you're a surgeon. He said, no, I want to stop doing surgery. I believe in manipulation, and I believe in doing chiropractic for the patient. So that was in 2022, and that took 45 credit hours, and it took 120 credits, and it wasn't that long. It wasn't I would say one course, and then I would go back to Kuwait and practice. They wanted me to practice over 1,000 patients and then come back and do the masters. And the masters, I did it just a few months ago and passed. Thank you so much.
Congratulations for
Thank
you,
you so much.
and
Thank you.
hopefully we can see you again
It would be
in
my
this
pleasure.
segment.
Yes.
And we are so pleased to have you in Midcast.
Thank you so much.
Thank you so much. Our dear viewers, we have reached to the end of this segment of Medcast. Hopefully we can see you again with another healthcare specialist. Until that time, goodbye.